First, I would emphasize again to have the best tool for diagnostics and monitoring. This is very cheap. They say it's expensive to have minimal residual disease or to have good imaging, but it's more cheaper than just one cycle of treatment. And if you don't know the efficacy of your treatment, again, you don't know what you are doing. And this will be my first recommendation. The second, okay, you know, the cheapest way to do medicine is to cure patients. And this is why we need to use the best possible treatment up front. Otherwise, it's very expensive. And I think the authorities should realize that we need to move this drug, and we need also to provide access about these drugs for every patient.